Okay, so we're just getting started on the left knee. We've already harvested the hamstring tendons, and with our Biobrace, they're going to be a 9.5 graft. Or actually, I'm sorry, it's going to be a 10 graft. What we can see here is you've got this chondral defect that I'm not crazy about. I wish you didn't have it. The defect actually was hinged, so it didn't look like a defect very much on imaging. But clearly unstable and clearly not okay to just leave. And so more than likely, with what we have available today, we're going to be microfracturing that. The camera here, please. Can you keep roll the knee like that? Okay, so we're just looking in the patellofemoral joint, and you've got a fair amount of arthritic change here as well. Let me show you. Here's the trochlea down below. You can see the irregularity in the cartilage layer here. It's right in the central trochlea. This is where the kneecap or the patella glides. We can track this all the way down to the front of the knee right there. So, again, more than I would like to see in someone as young as you are, but that's kind of the hand we've been dealt here. So we'll smooth it out as best we can. But this is no doubt where some of those loose chondral fragments are coming from as well. Okay, so here we can kind of measure the defect here. Looks like it's a couple centimeters across. Maybe 1.5 that way. And at least 1.5, if not 2, from anterior to posterior. Okay, so I wanted to show you next, let's go ahead and bend the knee again. I wanted to show you the lateral compartment because you do have a meniscus tear that we're going to try and address. Okay, so here's what we're looking at in the lateral compartment. This is the lateral meniscus. We're just posterior to the popliteus here. And you can see we've got these splits in the meniscus, both a horizontal one that way and a vertical one right there. So we're trying to figure out how to save this. And it may take a couple implants. But we'll get to work on constructing something here. Okay, so we've got one implant in, and that's holding things down pretty good. Here's how the meniscus looks over here. We've still got this split, and I don't know if I stretch it, we might be able to get a suture to close down the hoop, if that makes sense. We'll have a look at that. Okay, so we've got 2 implants in. One is an implant called Ceterix, the other is called FastFix. And you can see we've got the meniscus approximated. I'm really hesitant to try and put one more suture in because that whole construct could come apart. But at least the meniscus is restored there. And if we can get a little lucky and get that to heal, I think that'll be a win for you. We can talk about augmenting that with one of our biologics in the office later. But for right now, I think I'm going to call that good and leave that alone. Again, that's our final construct. As we straighten the knee out, gotcha. It's stable. We've already ranged the knee, and that's stable. That meniscus isn't going anywhere. So again, I'm happy with that. Pause. Okay, so this is where we're going to put our size 10 millimeter graft. And we're just going to get ready to make some tibial and femoral tunnels here. But it looks like we're going to have a nice shot to get this done for you. Okay, here's a pause. Okay, so we're going to pull the striped suture. And you can see how that's going to bring the graft into position. Okay, hold the camera there. And we'll keep working here and get this fixed. This is an adjustable loop button, so we'll show you once it's fixed. Just pull this all the way up, right? There we go. Okay, good. Okay, great. Okay, so we're going to go ahead and, here, hold this, seat the graft. We're going to pull up on the adjustable loop here. And it's a really neat device. You can see how it just pulls that right into position. And it's just disappearing into the tunnel just like it's supposed to. We'll show you some more in a minute. Okay, so here's the graft in position. I like the way that looks. We've ranged it. We're ranging it again. And it tucks back. It's a little hard to see the Biobrace. Sorry, we're going to get the knee flexed up. Help me flex the knee. There's one strand of the Biobrace you can see there. But it already looks like it's starting to absorb some of the fluid, and that looks good. So now we're going to work on the medial side, and then we'll be done. Okay, good. Hold the camera, Preston, please. Thanks. Okay, we're going to just gently do a little bit of a microfracture here. And then we're going to, this is kind of staging for a cartilage procedure that we're going to plan on. But in the interim, I think this is our best solution with what we have available today. Pause.